dural tube is where a lot of really amazing treatments happen. It's the core of our being. It's the spinal cord. It's the brain. It's the whole central nervous system. And dural tube techniques, in my opinion, are some of the highest skill we can do. It really requires visualization on our part as we work through the dural tube, and I'll explain that in a second. But I want to tell you a quick story about a young man named Brian. And I knew Brian, not his real name, from a previous injury. And he was, when I knew him, he was like 22 or 23, young, vital, healthy guy. And he came into my office walking like a 90-year-old. I saw him in the parking lot, and I thought to myself, that can't be Brian. He was literally bent over at the waist, could barely walk, and I said, Brian, what happened to you? And he goes, well, I was hit by a widowmaker. He was a logger. He was 26. He had 2 little kids, a young wife, and was disabled and was walking literally bent over with his head in hyperextension and his spine like that, only his head was actually probably more over like this. So he was walking like a 90-year-old man. And I don't know why I said this to this day. There's been twice in my life. Once was the lady with the banged her head that I told you about yesterday. And this was the second time where I said, we're just not going to let that stand. Don't know where I had the courage to say that. I just did. And I believed it at the time. So I said, tell me about what's happened. He said, okay, well, I had this injury. I had emergency surgery. I had a ruptured disc. The disc was, and the vertebrae were broken. The disc was ruptured. The vertebrae was broken. And in the injury, I tore the dura around my spinal cord. So not only did he have a disc pushing into his spinal nerves, but he actually had a tear in his spinal cord. Not in the nerves of the spinal cord, but the dural sheath that surrounds the dural tube. And what had happened over time, scar tissue had attached to this scar, and little spider webs of scar had reached out and grabbed onto other soft tissue in the body and pulled him forward and pulled him forward and pulled him forward. So that when I saw him, he was literally walking like this at 26 years old. He said, every time I try and stand up straight, I have a splitting headache. I'm in horrible pain. And he started crying. He said, how am I going to support my family? How am I going to live? I have a young wife, I have young kids. And that's when I said, I don't know how we're going to do it, but we're not going to let this stand. And so I had this inspiration that came from the blue, but it was really cool. And so he couldn't lay on the table because he was so bent over. And if he tried to straighten up, it would just pull in that fascial restriction in his dura. So we took 4 or 5 pillows and laid him up like this, and laid him over the table with 4 or 5 pillows supporting him, and he could be in this position. And then I had my friend Jeannie, who I was hoping was going to be here today, but she is not. I had her sit on that side of the table and take a hold of his occiput and start doing the traction that we're going to do next. It's called the dural tube release. And I went in to the occupational therapy room and got a piece of Dyson. It's a plastic, rubbery plastic that occupational therapists use to help patients with arthritis open jars and doors and stuff. It's real sticky. And so I was on this side of the table, and I took that little piece of Dyson and I got a hold of the scar right here. And the scar was tiny. If you just looked at the scar, you would think there's nothing wrong. But I got a hold of the scar with that piece of Dyson because I couldn't get a hold of it with my fingers. My friend Jeannie got a hold of his occiput and we started our traction. She put 5 grams of pressure in this way. I put 5 grams of pressure in this way. And the weirdest thing began to happen as we tractioned on that scar. He had so much heat that his back just started sweating, just almost gallons. I mean, just the sweat was pouring out of his face, out of his forehead, out of his back. And we said, Brian, do we need to stop? And he goes, no, it's good pain. So we continued on. And I continued to traction and follow that scar tissue wherever it would go, just like we've talked about. Jeannie continued to traction at the occiput. We had both ends of his dural tube connected. And we did that for about 30 minutes. The sweating sort of stopped. He didn't really completely stop, but it calmed down. His pain calmed down. And when he stood up to about here. And he goes, well, that's better.
One treatment?
One treatment.
Wow.
And so I said, okay, so that's enough for today. Come back. So let's say this was a Wednesday. In physical therapy land, we often treat 2 to 3 times a week. So he came back on Friday. He was still walking like this, but he said, hey, my pain's about 40% better. So we, again, got him up as high as we could get him with pillows, did the same thing again. And at the end of the second treatment, he was standing up like this. I think I saw him 4 times and he's completely back to normal. His pain was gone. And he went back to the workman's comp system, retrained. He's now in a different field where he can use his technical skills, but he's not in the woods anymore. And I've seen him multiple times since then. Every time I see him, he gives me this big hug because we saved his life. And I'm not saying that because anything I did. I mean, it was an inspiration. That was wonderful. And I've had several experiences like that doing dural tube work, which is why I want to share that with you this afternoon. Because dural tube work is extremely powerful and in the right setting can be life-changing.